Welcome back. Good evening, you with the full view. I'm Stephen Curtis. In our studio tonight, Ronald Lamola, a member of the National Executive Committee of the African National Congress, one of the policy heads of the ANC, let me put it that way. Ronald, before the break, we were talking about the Reserve Bank and the mandate. Let me just put this in very crystal clear language. There's a temptation for governments around the world to interfere with the mandate of the Reserve Bank, because what you can do is you can make it easier by lowering interest rates for an economy to grow and for more people to be employed. It is just before an election, but economists also call that a sugar high, because in the end it means that the prices of goods rise, you have higher inflation, and that hurts the poorest of the poor the most. You're saying that's not going to happen.
Yeah, remember the independence of the Reserve Bank is guaranteed by the Constitution. So we understand that for the Reserve Bank to function optimally and properly, it needs to be independent. But obviously, government has got concerns of unemployment, has got concerns of economic growth. So we need to also see how does the Reserve Bank enhance this and help us to achieve some of the objectives that we want to achieve with regard to economic growth and also to resolve the issues of unemployment.
There's also a conversation about the nationalisation of the Reserve Bank. It does have a structure that I think no one would adopt now if they were forming a Reserve Bank from scratch for the Republic of South Africa. There are private shareholders. They have nothing to do with the mandate. They have nothing to do with that. All of the governors are appointed by the President. Your Secretary General says the bank will be nationalised in 5 years. Ace Magashule said that over the last 48 hours. Is the bank going to be nationalised in the next 5 years?
I think there is a discussion to look into how do we enable the Reserve Bank to function as independently as possible. With regard to the issue of nationalization, there are issues that are being considered. For example, there are private shareholders, as you have said, which will have to be paid at market value or even at a price which will have to be determined by international arbitration if we do it without compensation and so forth. So all those integrities have to be looked into and therefore present what will be viable and see how will that benefit the economy in terms of what we want to achieve and in terms of what the manifesto is speaking about. It is not just going to be some irrational or reckless process. And that's why you have seen the ANC is currently busy with the research to look into the issues that can be looked into this matter, particularly the realities that you might sometimes do it, but not still have what you want to achieve, because the Reserve Bank is an independent, in terms of the monetary committee must be independent. It must be able to take decisions based on the facts before them.
I suppose the question comes down to a simple one, really. Would it benefit the people of South Africa to nationalise the Reserve Bank? Most of the economists I've heard from say that it wouldn't really make much of a difference, apart from costing them money to buy out the private shareholders.
And that's what we are looking into in the process. And I think from the Lekgotla and going forward, the ANC is now collecting data to see what will be the benefit and how will that enable us to help in terms of the economic growth and also in terms of unemployment, particularly in the country, and also the reality that you are raising of the private shareholders. How much, if we have to pay them, is going to be paid, and if we don't have to pay them, what will be the consequences? Those are all issues that we are looking into.
One of the big issues, of course, in the manifesto, when you consider where the public debate is, it's an issue you've examined very closely, is the issue of land and expropriation without compensation. Many people looking through your manifesto thought that perhaps it was quite moderate language. It didn't seem to be particularly extreme. It seemed almost that the ANC was sticking very much to what's already been said before about this issue when it comes to land. Are you not worried about almost being out-radicalized by the EFF on land?
No, we have to be realistic. We have to be prudent. Remember, when we do it, we need to do it within the just and equitable principles that are outlined in the Constitution. And we've already put together a framework in terms of the expropriation bill, in terms of the categories of land that can be expropriated without compensation, which is out for public comment, and is also going to be enhanced by processes from within ourselves to see what more can we expand to enable, because you must remember, expropriation without compensation is not the only instrument that will enable land reform. There are other various instruments. This is just an additional tool into the arsenal of land reform. And our biggest aim is to enable it also to enhance economic growth, to bring people that have not been able to play in the economy, but also to unlock some of the rural areas, also to unlock the potential of the rural middle class to come into the economy, and also to develop certain areas across the country which are currently not developed, and also to look into some of the semi-urban areas where people need land for residents and also for economic activities, How do you enable people to do that and also to participate into the mainstream of the economy and also to undo the apartheid spatial planning? So it is not moderate at all. It is revolutionary, it is radical. It's just that it has been well thought of.
Let's talk about health now. And I mean, obviously your manifesto spends a lot of time talking about health. So do people in mainstream media and social media at the moment. Your manifesto promises to introduce the NHI, the National Health Insurance System. I think we have had previous manifestos that have promised the introduction of that NHI before. Is it going to happen in the next parliamentary term? In other words, in the next 5 to 6 years?
Yes, it will be, because there is an acknowledgement that it has taken long, but there was a process that has been undergone by the Department of Health. There have been various public consultations. I think now we are ready, including the President appointing people to help the ministry and also in terms of technical skills to enable us to bridge the gap between the private and the public health sector in terms of services. So we are ready, and at the end, whatever that you may have in terms of policies will have to be implemented by a capable state. And that's why the President also spoke about a capable state that will enable us to achieve whatever is land, whether it's land reform, whether it's healthcare, whether it's education, needs a state that is capable and is able to implement. And it is in that context that we are confident that we'll be able to move forward. And the department has already published some of the bills that will enable the implementation of NHI.
There's several problems in the health in the health sector generally. I mean, there's the sheer number of people who need care, need treatment. There's the shortage of doctors, which is related to that. There's the quite serious claims of corruption that come from various NGOs that work in the sector. I think there have been 1 or 2 concessions from government people who work in the sector. Will the introduction of the NHI improve the capacity of the government healthcare sector to treat the people who need the most care? And by that I mean the poor. If it doesn't improve the capacity, it doesn't really do anything for voters.
It will definitely improve, because you'll remember in the manifesto it says that it needs to enable us to even share skills with the private sector. So if there's a skill in the private sector or in the public sector, they must be able to be shared for us to deliver the service that is needed, including for the poor or for all South Africans. But also there must be the rich who are able to subsidize the poor, the middle class and so forth. So it's going to be a comprehensive package that will enable all South Africans to enjoy the same level of healthcare, rich, poor, young and old, black and white. That is the aim of the NHI.
In all societies, if you have rich people who have something and then someone tries to make them share it with the poor, no matter what that might be, there's resistance. Are you prepared for that resistance in whatever form it may come? And I'm talking about legal challenges, all sorts of things that could happen.
Yes, we are prepared, but I think there has been an acceptance of the NHI by many South Africans in terms of the public consultations, and that's why now it's at a stage where we are ready to move with the implementation in terms of legislations and so forth. So there has been a lot and enough consultation. So even if there will be challenges, they won't be that high. They will be minimal, but they won't also obstruct the implementation of the policy. Government will be able to handle whatever challenge that may come. But also, I have also seen in the country that there is a willingness even from the rich, because they can understand that the country is in dire situation. It needs all South Africans, rich and poor, to come together and bring their heads together and build a South Africa that all of us will be proud of.
Ronald Lamola, nice to see you again. Thank you very much indeed for coming in tonight. I really do appreciate your time on SABC News. Ronald Lamola is one of the policy heads at the ANC, if I can call him that. He's a member of the National Executive Committee of the African National Congress.